Hello, everybody. My name is Jeremy Shaba, and I'm a veterinary student at the Ontario Veterinary College. I'm here today with Dr. Angela Infante, a 2013 Michigan State University graduate and a current ambulatory intern at Rood and Riddle Equine Hospital. Thanks for being with me today.
Thank you for having me. I'm so excited.
Yeah. So I thought we could just start off, and you could maybe give a brief overview of the internship program there and kind of all that's involved.
Sure. So the internship program, there's different types of internships. I'm, like you mentioned, in the ambulatory department, and then there's hospital interns. The ambulatory internship is set up where it assigns you with one senior clinician, so you're on with that senior clinician for the entire year. Most of the ambulatory department sees a lot of repro, a lot of sales work, and there are a few that I can think of that do a lot of sport horse type of medicine. And then, so we're on with that senior clinician all throughout our entire year-long internship. Whereas the hospital is set up that they rotate through every 3 weeks with medicine and surgery and anesthesia. So I have like a rotating type internship where we actually have just one senior clinician that we work with primarily throughout our year.
Cool. And are you responsible for any emergency work or treatments at all
Yep.
during with the
Yep.
ambulatory part?
Yeah, absolutely. So basically, most of the interns, there are 5 ambulatory interns and I believe 8 hospital interns. I think there might be actually 10, but I think there's 8. But our 5 ambulatory interns that we have, their senior clinician works for individual farms in the Lexington area, and we are actually on call 24/7 for our farms. So we have to be available for them. It doesn't mean we have to be a certain distance from them. Like the hospital interns, they have to be, if they're on call, within 10 minutes of the hospital in case an emergency comes in. Whereas it's not expected for us to be, 10 minutes away from our farms every single day and night, but we are expected to be within a reasonable amount of time away from our farms. But yes, so we are responsible 24/7 for our treatment goes. It depends on the treatments that you're referring to. A lot of our have night watchmen, and the night watchmen are perfectly capable of treating any of the sick horses on the farm, whether they be the mares or the foals. The only time that we're responsible, and that a particular situation that I can recall, is when it comes to giving IV fluids. Like, I'm expected to go out there and give IV fluids to the horses, make sure the catheters in, make sure that the fluids are given appropriately. But as far as like treatments, a lot of the farms can handle that on their own with their own night watchmen. But I'm sure that there are some smaller farms that do have their interns come out. I just not really familiar. Not in my particular situation have I had to go out for treatments.
And you also mentioned that you're assigned to one doctor the entire year. Is that correct?
Yep.
And so you're not allowed to ride along with other vets at all, or?
No, you are absolutely allowed and encouraged to go out and ride with whoever you can if you have time. There have been times where I've been slow that I've gone down to the surgery department and scrubbed in, or I follow in cases that I refer to the hospital from the farms that I work at, and I get to scrub in on the surgery or observe at least closely. And I've ridden along with all the doctors in the ambulatory department and gone with them, especially on slow days, or if my senior clinician is out of town and the farm is covered and there's nothing going on. It is highly encouraged and recommended to go along and pursue your own personal interests that you may have. For me, I realized that I have a really strong interest in sales work and sales surveys, taking radiographs, endoscopic exams, stuff like that. And so if my senior clinician is not working in that area or not doing something to that, that day, it is highly encouraged and kind of not expected, but it's just it's a good idea for you to go out and do what it is that you are interested in doing and pursuing your own personal interest.
Yeah, and that's good to hear because I've I've heard from some of my friends that you're assigned to one doctor the whole time and you're kind of with them the entire year. So it's good to hear that you're allowed to move around and encouraged to do so as well.
Yeah, absolutely. They don't, and they always say that if we're slow and there's something else like that you want to see, whether it's you want to work with someone who is doing a lot of ultrasounding or you want to go with someone who is going on other farm calls, I think that it's important to ask that in when you're looking for internships. If you are assigned to one senior clinician or mentor for that year, to ask them if you have the opportunity to go off and go look at, or observe or work with other doctors that may be doing something differently. Because in the end of it all, it's your internship and you have to make the most out of it. No one's going to tell you what to do with your time. You have to be kind of motivated and dedicated to seek out the most opportunities possible. And I think that they look at you, they look at interns that come through and do that and are like, wow, they really are interested and they really are trying to make the most out of their internship year. And I respect that for them. I respect them for that.
Yeah. What would you say has been the biggest challenge so far in the past couple months since you've started?
Um, well, it's a very steep learning curve, I think, when you get out of school. I think it's difficult for me to say it across boards because my internship is really, I think, a little bit different than a lot of others. Being at Rood and Riddle, we are a huge equine hospital, and I love that, and I absolutely love that. And the caseload is very high, and I also love that. But it's a challenge. Like time management, I think is really huge. You're at school and you have a lot of clinicians looking at you, and you can always feel comfortable enough going to them and asking them questions. And at Michigan State, it wasn't as busy, and so I felt like I had more time to dedicate to every single case that I was on. And here it's just you just go and see so many horses right after another that you kind of get lost in the shuffle of things.
Yeah.
So I think being really good at time management and prioritizing what was more important versus things that I could do later and what I need to do right now. I think those were the two things that I kind of struggled with in the beginning. I think that it was it's really easy to like get lost in the not commotion, but in the
Daily shuffle.
yeah, and the fact that there's so much going on here all the time. There's always something going on. So I think learning how to time manage and be efficient and prioritizing like my tasks was a struggle in the beginning. But I think that I've kind of gotten a little bit better at it. So
Yeah.
I think that was the hardest part.
And you mentioned that it is a huge hospital and the caseload's really high. And a lot of people say, when you go there, the interns don't get to do very much and they don't get a lot of hands-on. What would you have to say to those people?
Oh, I don't think that's true. I would have to disagree. I feel like I get a lot of hands-on, more so than I ever thought that I would. And But that's why I picked a large referral hospital like Rood and Riddle, because of the fact that it's such a high caseload and I'm bound to see a lot of things, and that's what I want. I think that when you see a lot of the same things and a lot of different things, you get really comfortable with practicing medicine and being a good veterinarian. And I think that the fact that I get to do a lot. I can't even say that enough, but I really do get to do a lot of hands-on. There's so many opportunities to really be hands-on and get to do things and enhance your skills and enhance your communication skills, enhance your technical skills, that I don't really think that that's true. I think that it is I think you get to do a lot of hands-on. But in that same regard, I also feel like you have to be motivated and dedicated to ask and to want to work and want to do stuff. So I think that sometimes it's such a big hospital that people are intimidated because of its name and its reputation. But I think that you'll find that if you ask if you can do things, people are very receptive to that and willing to, let you try at least, if you're willing to ask and willing to show that you're interested.
Mm-hmm. And is that experience true whether you do the ambulatory or hospital internship, would you say?
I think the hospital internship is probably set up a little bit different, and I can't really, comment on how different or how hands-on the hospital internship is. I think that they, the amount of surgeries that they scrub into, and they scrub into surgeries,
Mm-hmm.
um, the amount of surgeries that they assist in, and everything like that. There's tons of hands-on opportunities, and it's not just surgery; it's medicine, handling of you know, all these different clinical cases that come through. They do a lot of lameness, a lot of diagnostic workups, a lot of blocks, a lot of everything that you don't necessarily get to as you get to see, or you would think that they would be allowed to do, but they
Yeah.
do get a lot of hands-on. And I currently live with a hospital intern who is also a fellow Michigan Stater, and she loves it, and she does a lot too. So
Yeah.
I think that it is a lot of hands-on, and I would have to disagree with people who think it's not. But I also think that you have to be willing to put forth the effort and put forth and show that you're interested enough to want to do stuff too.
Yeah. And so I know there's a lot of students out there who are still kind of teetering the fence on whether or not to do an internship. What advice do you have for them?
I think that in order to really figure out whether or not you want to do an internship, it's really crucial to go and visit and do an externship. I think doing an externship for however long you can fit into your schedule will help provide at least a pretty good foundation or an expectation of what your internship year would be like,
Mm-hmm.
and the type of practice that you'd be, partaking in as far as your internship year. Um, I think that and I know everyone knows out there, and I think that it's very common knowledge that an internship is a lot of hard work, but everyone has always said to me that an internship is what you put into it, is what you get out of it. And so
Mm-hmm.
I think that if you go in with the mindset of it's 1 year of my life that I'm dedicating to enhancing and enriching my profession and
Mm-hmm.
my career as a veterinarian, I think that, you'll have bad days, but you'll definitely have way more good days, and you'll learn so much, and you'll get to do so much that I don't think that there's anything really bad about doing an internship if that's what you have your mindset on.
Yeah.
um,
Did you always know you wanted to do an internship?
I did know that I wanted to do an internship. I didn't know where. I knew I wanted to go to Kentucky. I just didn't know where I wanted to do my internship at. And if it wasn't for my externship and coming to Rood and Riddle and just seeing how wonderful everyone was, and how friendly and warm and inviting, and how willing everyone was to teach, then I wouldn't have picked them. I never would have thought that I was going to go to them. And so that's why I think doing an externship is so important, because if it wasn't
Yeah.
for my externship opportunity, I never would have chosen, or never would have applied to the practice. And so I think doing an externship is important. And I also think talking to your fellow classmate or peers. I had a couple friends that were upperclassmen that had gone and done internships at Rood and Riddle, so they had recently graduated, and I had asked them about their experiences,
Mm-hmm.
and they had a lot of positive and negative, pros and cons about everything. Um, I also think talking to clinicians, the clinicians at Michigan State, I found great mentorship in them, and they were awesome as far as guiding me and telling me what they thought would be a good fit for me. Sometimes it takes someone on the outside to tell you where they think that you'd excel in,
Mm-hmm.
and so talking to them was awesome, and they were super super helpful. So I think that with that, externships, talking to people who've done internships at the practice that you're interested in going to,
Mm-hmm.
and the clinicians at your college, they're all huge assets in helping you make your decision as far as whether or not you want to do an internship.
Cool. What would you say has been your best experience so far in your internship?
Um, Besides people calling me doctor, I think that the best the best experience in for my internship is just the wealth of information and knowledge, and being
Yeah.
able to practice and do things that I love every day. Like, I know it's a lot of work, and a lot of people are like, oh my gosh, you work 7 days a week and you're on call 24/7. But I legitimately love my job. I love waking up every morning. I love going to the farms. I always tell everyone that I have the best office ever because I drive around in my car, and I'm surrounded by the most beautiful scenery and the most beautiful farms, the most beautiful horses. I feel really, really lucky and privileged to be able to work in this area and to be able to be surrounded by such, good horsemen, good doctors, amazing resources.
Mm.
Um, I also think, being able to treat something that's sick and being taught that at school on how to go ahead and do that, and then being able to actually implement that as a veterinarian and watching that animal get better is amazing too. Like, you think that you're going to do that when you're in school, and then you hope that you're going to do that in school, and then when you actually do it when you're out in practice, you're like, oh my gosh, I really did learn a lot, and I'm really able to implement my knowledge, and
Yeah.
um, just making small strides in the confidence direction has been awesome. But I really don't have a lot of negative things to say about my internship year. I think it's been awesome, and I think that and it's just been such a learning experience, and I think that I'm going to take with me forever, and hopefully will help shape me into being a really good veterinarian in the future.
Yeah, that's good to hear. It sounds well. You still have a little ways to go.
I do.
Yeah.
We still have the breeding season to go,
Yeah.
but I think that it was been a really good opportunity for me. And like I said before, if it wasn't for the mentorship that I got while in vet school
Hmm.
and the mentorship that I've gotten here, I really think that it's made a world of a difference as far as actually enjoying my internship.
Cool. Well, thank you for chatting with me today. I know a lot of students will watch
Yeah,
this and find it very helpful.
yeah,
Yeah, and
yeah. I hope so. Just to help someone out.
yeah. Alrighty, take care. Have a good night.
Thanks. You too.